The key to making good, informed decisions is information. We have been told for a very long time that there's really not much research about diagnostic ultrasound use in pregnancy, and it can generally just be treated like it's safe. Well, first, why have we just accepted that? And then marched headlong into nearly every mom getting multiple ultrasounds done in every pregnancy without asking some basic questions like, why aren't there studies? But beyond that, is it even true? Is it true that there aren't many studies? Spoiler alert, the answer is no. It isn't true. I get asked these questions quite a bit, so I'm jumping into some hot water today, and I might make you mad, but then I hope that you'll think it through and that you'll make some hard, against the grain decisions moving forward. Let's go. Are you a Christian woman yearning for a beautiful, joyful pregnancy and birth with a focus on God, not medical tests? Are you worried the birth you want isn't possible and you're tired of being treated like an accident waiting to happen? Hey Mama, I'm Lori, host of Your Birth God's Way. I'm a certified nurse midwife now, but I wasn't always. After working for nearly 20 years in the broken maternity system, I too was in your shoes wondering how I could have the birth I wanted and that I felt God meant for me to have. I found a secret that has actually been known since the beginning of time. God's way is the best way. Spoiler alert, God made us and our babies, and He knows us best. He designed us perfectly for pregnancy, birth, and nourishing our babies after birth, if we work with His design and not against it. In this podcast, you'll learn how to be healthy and have joy during this time of life that will be over before you know it. So if you're ready to reclaim your birth and your babies for His glory, go turn on a few episodes of Bluey for that little one on your hip so you can put the focus back on you for a few minutes with me. It's review time. Today's review comes from Curly Hair Mama from back in December. She says, wow, just wow. I'm a breastfeeding counselor working with moms in a rural Western North Carolina county with 1 year of experience. Previously, I was a special educator before following God's leading to homeschool and better disciple my own 2 children. I have learned so much through my department trainings, but I was looking for a more faith-based prenatal and postpartum education. This podcast has been such a blessing and has taught me so many new things to help my clients and their families. I've even shared many podcasts with my husband, and we've learned together too, especially the birth control discussion. This episode was life-changing for us. Through God's mercy and providence, we are pregnant with our 3rd, and I'm relying even more heavily on Lori's teachings. And then she said spelling. I think she thought she spelled my name wrong. She didn't. Thank you, Lori, for your work, and thank you, Heavenly Father, for this ministry. And P.S., I've had 2 previous C-sections, so I'm hoping to hear more info from you on recommendations for this delivery. From my learning, I'm wondering if I should have even had my first C-section. Thank you so much, Curly Hair Mama, for that review. First of all, I want to say I really hope that you heard episodes 111 and 112 that I recorded back in September after Hurricane Helene came through your area. I recorded those specifically for that situation, hoping to be able to help some moms out there, and I hope that I did. So I hope you heard those too. Second, I'm not sure if I've done an episode on VBACs. I probably do need to do one. I have several moms who have had Midwife and Me Power Hours over that topic because it's such a personal situation and it's also very situation dependent, and so you're always welcome to book one of those with me where I can work through your specific situation and kind of talk you through the different sides of it. But I will put that on my list of things to consider for future episodes. Just breaking in here post-production to say that I actually have done 2 episodes on VBACs. You can go all the way back to episodes 47 and 48 to learn more. If you have not left me a review yet, please take a quick 30 seconds to hop over on Apple Podcasts, either on your phone or your iPad or your friend's iPhone or iPad. Just leave me a quick 5-star written review. It helps me so much to find other mamas like you who could use this information as they plan their journey and try to, break free from this broken medical system that we find ourselves in. Okay, so today, speaking of broken medical system, today we're diving into another topic that I know is going to go against what the conventional wisdom tells you. I'm okay with that. Conventional wisdom is what got us into this mess we're in to start with. Okay, so today, the first question that I want you to consider, and honestly, I really ought to start every episode this way. This is the first question you should always consider in anything. that you do in your pregnancy. Is this technology, and we're talking about ultrasound this episode, is this technology a gift from God, or is it another attempt at for man to control something that isn't controllable? Think about that. Have ultrasounds brought us more blessings or more problems? Have the lives that have maybe potentially been saved as a result of ultrasound technology been worth the massive increase in interventions that have happened to most, if not all, moms as a result? Yes, those lives are obviously very valuable, but how many downstream consequences have arisen for kids and babies, for babies who are kids, who never would have had any of these interventions because there wasn't a need for them if all moms weren't getting ultrasounds like they do? These are some things we really need to think about and consider. I pose to you that the widespread use of routine ultrasound and the acceptance of it is tied directly to the fact that you have been trained your whole life to fear birth. You may not have realized it. It may not have been somebody, standing in a classroom teaching you how to fear birth, but just the undertones of everything that happens in our culture teach you that birth is something to be afraid of. So even if there is nothing wrong and you have no reason to go looking, you still go get one just in case. And I get it. I did it too. I did it because I just wanted to make sure that everything was safe for a home birth. And I still don't necessarily think that that's an awful thing. But I want each of you to take into consideration the information I'm going to share with you today. I want you to go get a couple of resources. I want you to do some reading and do some actual real research on your own so that you can decide with proper information, not just because it's what everybody does or it's what we've always done. I want you to think about something else too. And this one might be a little tougher, especially if you might have a child already who has some of these situations and there's nothing you can do about it now. I understand that this is hard. I don't want anyone to hear this and dive into guilt because you can't know what you don't know. All you can do is do better moving forward if you learn something that changes what you would do. Think about this. We have an epidemic of chronic disease in all people in our culture, including babies and children. Things that used to be absolutely unheard of, things that either didn't exist or barely existed, are now prevalent. But here's the kicker. These things like autism, ADHD, all kinds of bowel issues, gut issues, learning issues. There's so many different things that we're seeing happening frequently. And that was just the ones that popped in the top of my head. There are many, many more. These show up in babies of all classes. And what do I mean by that? From the poor women who barely can get by to the richest, most wealthy women who have the absolute best in nutrition and have all the vitamins in the, quote, best in OB care. We could argue whether it's the best, but you get what I'm saying. So what is causing this? It's happening to everybody. I think personally it's a combination of things, but I also think that this might be one of them because oftentimes studies are showing that these are cumulative and they kind of all build on top of each other. So I want you to keep listening all the way to the end, and I want you to decide what you think is potentially causing things. Question number 2, I want you to consider. What does it suggest to you when you are told that ultrasound is generally regarded as safe, but studies in humans are limited, and yet you find out that there are over 50 studies in humans on ultrasound? Now, you've probably been told, if you've ever had this discussion, you've probably been told that doesn't exist. Guess what? It does. And down in the show notes, I have linked this book, which may be backwards if you're watching this on video. This book. This is one of the most boring, dry books you'll ever read. It is not written to entertain you in any way. This book is a review of studies. It is called 50 Human Studies in Utero Conducted in Modern China Indicate Extreme Risk for Prenatal Ultrasound, a New Bibliography. by Jim West. It's not very thick. You can definitely read it pretty quickly. And it goes through these 50 human studies and it shows you what they were studying, how they studied it, and what they found out. Caveat to this, they are, most would consider unethical studies. I'm not defending the ethicalness, is that a word? The ethics of the studies. What I am saying is that the information is there and we need to learn from it. He explains in the book the methods, and you can decide for yourself whether they're ethical or not, but that's not the point, honestly. They're already done. Are we going to ignore the information or are we going to use it? These studies were done between 1988 and 2011. That's not that long ago. These are not old. These are relatively new when you look at the fact that they've told us there are no studies. And yet we've been told there's nothing. Some of these studies found that low intensity, brief exposure to ultrasound did cause damage. With those questions in mind, the first two questions that I asked, I want you to realize that I am just skimming the surface in this episode. My main goal in this episode is for you to think and to get you to go do more research. Most of what I'm going to share today comes from this book that I just mentioned by Jim West and an article by Dr. Sarah Buckley, along with my thoughts and my experience. Both of those are linked below. Also, my resources page on my website has several more articles that I would love for you to go read and consider. When you go to go.yourbirthgodsway.com/resources, scroll down just a little bit, you'll see ultrasound information, and there are several links to other articles that are completely free that you can go read and think about and consider on your own. Okay, so let's get to the basics first. I want to start with what is the definition of ultrasound? What is an ultrasound? Some will call it sonogram. You may have heard that term. It's the same thing. It comes from the word sonar, which is a reference to its origins that we'll talk about in just a minute. Ultrasound is an ultra high frequency sound wave, or I should say ultrasound is ultra high frequency sound waves that travel at 10 to 20 million cycles per second. For comparison, audible sound, like my voice you're hearing, travels at 10 to 20,000 cycles per second. So it's a whole lot higher frequency. It's emitted by a transducer into the abdomen, either through the abdomen or through the vagina. We'll talk about that in a second. The waves then reflect back to the transducer. It sends out the waves. They reflect back based on what they touch. And they found that different tissues send back a different echo, which then is transmitted into a picture on a screen, and they look different. Okay, so that's how you can shoot the ultrasound waves into an abdomen and see bones and see flesh and see organs and see tissues and placenta and all these different things, and they all look a little bit different. It's because of the way that the sound waves echo back. Again, I said just a second ago, there are two routes. There's abdominal, which is where they put the transducer that's a little bit wider through the abdomen, and it shows the pictures on the screen. And then if you're getting a first trimester ultrasound, you often will have what's called a vaginal ultrasound. It is basically, it's just stuck into your vagina, and it gets right at the cervix, right against the cervix, and there's very little separating that teeny tiny baby and the transducer. It is pretty unpleasant, and there's just it's very close in proximity to the baby. So why are ultrasounds used? Well, they're used to diagnose pregnancy sometimes, just to show that there is a baby in there. They're used for dating pregnancies, meaning figuring out how far along a mom is. It's not very accurate to use ultrasound for dating after the first trimester. This first trimester is fairly accurate, but past the first trimester, it gets less and less accurate the longer you go. It's used to evaluate problems like bleeding and development. You can evaluate growth. Sometimes it's used to look for multiples to see if there's twins or triplets or something like that. It's used to look for placenta location and status, especially in this day and time where we have so many more people with placenta issues like placenta accreta. Ultrasound is used to diagnose whether or not that might be present. So what's the history of ultrasound? Where did it come from? Well, it was developed during World War II by naval forces. It was used to detect enemy submarines, and it was basically shooting the same kind of waves like what we're using now in ultrasound technology down through the ocean to find submarines, because those waves, they would shoot them down, they would bounce back and send a signal that then they could interpret to see where there might be enemy submarines below them. Interesting side note that might tip you off to where this conversation is going to lead. Marine life often dies, even the large animals like whales, where sonar is used, especially where it was tested. Just keep that in mind. So after the sonar technology was developed by the Navy, a surgeon named a surgeon in Glasgow named Ian Donald started to experiment on tumors that he had removed from his patients, and he used steak meat, like a beef steak, as the control. So he was shooting the waves through tumors, and he was shooting the waves through steak, which is muscle from cows. He found out that the different type of tissues gave off a different look on the ultrasound. So that is what then later progressed to the picture that we use coming from that echo, where we can see our babies. Ultrasound's also used in other aspects of medicine. It's not just prenatal care. It's just that in prenatal care, it's probably the most prevalent and the most widespread. So the technology spread like wildfire. It became available commercially by 1963, and then by the late 1970s, it was a routine part of OB care. But I want to just kind of take a step back for a minute. Okay, so that quick, we get the technology in the 1940s, it becomes commercially available in the 60s, then by the 70s, it's everywhere in OB care. But what other things have we seen come through OB care that spread like crazy, everybody thought was the greatest thing, and then come to find out it was harmful? Ever heard of something called DES? I'm going to try to pronounce it. It's not the easiest. Diethylstilbestrol. DES was a synthetic estrogen. The FDA approved it in 1947, and it was sold as a drug that would improve maternal outcomes, even though no studies were done with controls, meaning nothing was ever compared to placebo. They finally did studies with the placebo in the 1950s, and they found that the controls, meaning the ones who didn't receive the actual drug, had bigger, healthier babies, and the group that received DES had more preterm labor and more miscarriages. And yet, even though that was happening and the information was out there, doctors continued prescribing it for 20 years. One study was actually done in Chicago with controls, but none of the moms even knew it was happening. And that's where they were finding out that the moms who didn't get the drug were having better outcomes, and yet the drug kept being prescribed until finally they couldn't deny it anymore and they took it off the market. What about thalidomide? Does that ring a bell? Thalidomide was used to treat nausea of pregnancy in the 50s and 60s. In the 60s, though, it started to become evident that thalidomide was causing severe birth defects. Even after this was known, the drug was still used in some countries into the 70s and 80s. You see the trend here? X-rays were the same. When X-ray technology came around, they were using X-rays to look at babies, and they were using X-rays to look at pelvises to see if they thought that these babies were going to fit through the pelvises of these moms. And guess what? They had babies being born with cancer and all kinds of things wrong with them. We have a long history in obstetrics, especially in this country, of experimenting on women. And I really think that someday we may look back at ultrasound at being the next experiment. I can't prove it, it's just my gut feeling. Before I go too much further, I just want to add one quick point. So when you go into a labor and delivery unit in America and most countries, you're going to get put on continuous electronic fetal monitoring. That's where you get the one transducer on the top of your belly and then another one usually lower down on your belly that are held on by straps. And they connect to a machine that then makes little lines on the paper, right? The one that's lower, usually for most moms, is called a Doppler. Dopplers are ultrasound technology. Except for that type of ultrasound technology is continuous. That means that throughout the time that it's on you, it is constantly sending those ultrasonic waves through your belly into your baby. When you get the ultrasound where you get the little pictures, maybe at 20 weeks or whenever, those are intermittent. They're quick blasts or bursts that are then cut off while the interpretation is done, and it's usually just for a few minutes. and that's it. Yet you may be in labor for a day or two. And that's constant, continuous ultrasound to your baby. I just want you to be aware of that. Okay, let's look at the pros and the cons of ultrasound. Now, I'll admit, I didn't go real deep into the pros because I'm sure you probably already know the reasons that you want ultrasounds, the reasons that most people want ultrasounds. And at this point in my knowledge and career, I really struggle to come up with many pros because most of it is very want-based. It's not need-based. But some pros that you can consider, some reasons to do ultrasound, include the fact that you might find abnormalities that can help you better decide on the best place to give birth. What do I mean by that? There are certain conditions that maybe are a better option to give birth at a hospital so that you have the resources available that hospitals have. So, in those cases, it can be beneficial to know if those things exist. Also, if you don't have regular periods, or maybe you don't have periods at all yet, maybe after you've had a baby and your periods aren't back to normal, or maybe you haven't even returned yet and you think you're pregnant, ultrasounds can tell you, first of all, that you have conceived, but also can verify or establish your due date, guest date, whatever you want to call it, if it's done in the first trimester, because they are very good at dating in the first trimester. Past the first trimester, they're not very good, but first trimester, they are. So those are a couple of reasons why ultrasounds can be beneficial. Of course, once you've diagnosed something, they can be beneficial to help you keep looking and to see how they're progressing. But I think as we go on, you'll see whether or not that is worth it. You can also verify things like the placenta location, which is very beneficial if you might be concerned, like if you've had bleeding, you're concerned with maybe a previa, which is where the placenta has formed over the cervix. It's also very beneficial to know where the placenta has formed if you've had a C-section before, to make sure that that placenta accreta situation has not formed. So there are ways that ultrasound is used that is beneficial. And I don't really deny that. It is just that we have to weigh the risks and benefits, and ultrasound, like many things, has been sold to have no risks, and that's not true. And so here's what we need to talk about now, and that's the cons. This list is longer. It's things for you to think about and consider. Obviously, this doesn't happen to everybody, but if it happens to you, it's a big deal. Cons of ultrasound. It can lead to increased blood flow and temperature in the areas where it's directed. That can be a big deal, as you know, because those temperature changes can impact the baby, especially the baby's brain. It can create gas bubbles called cavitations, and those cavitations can also get heated, and they can cause problems when those little bubbles form in certain areas of the baby. They have been shown to change the way rapidly dividing cells act. And what is a baby besides a bunch of rapidly dividing cells? Okay, I'm not saying a baby's a clump of cells. That's not what I'm saying, that the pro-abortion industry will say. That's not what I'm saying. What I am helping you understand, though, is that baby that is a real person that has a soul, you, for that matter, are made up of cells. And that baby is rapidly dividing cells, because those cells are going from 2 cells to millions of cells in a very short period of time. Okay, so if an ultrasound is going to change the way rapidly dividing cells act, it might change the way your body's or your baby's body's cells act, how they divide, how they grow. It can change the way that the fluid around cells move. Long-term effects are not grossly unknown, but by and large, they're unknown. But consider this, that a study done on cells grown in a lab showed abnormalities caused by ultrasound exposure persisted for several generations. So that means that, they did the studies on the cells right there in front of them, and then those cells divided and they made more cells. And for several generations after that cell, the changes still persisted. They could still see the differences in the future cells. Okay, that's disturbing. That can, if you carry that on out to what it could mean for a baby, and maybe even that baby's baby, there's something there. Another study in rats showed that ultrasound caused damage to the myelin that covers the nerves, and it caused a 22% reduction in the cell division rate and a doubling of apoptosis in the small intestine. Apoptosis is the body's way of cells that are done doing their job, how they die, programmed cell death. Okay. So it should happen. It needs to happen, but it doesn't need to happen too much. And in this case, it happened twice as much as it normally would. Okay. So 22% reduction in cell division rate and a doubling of the apoptosis. A Cochrane review found no benefit in terms of outcomes in perinatal mortality. So what does that mean? Out of all of the ultrasound that we're doing in all aspects of prenatal care, there hasn't been an improvement in perinatal outcomes. There hasn't been a reduction in neonatal or maternal death or morbidity. So why are we doing it? Not all situations, by the way, that you find in an ultrasound are easy to interpret. Sometimes you might find something that you can't really explain. That leads to anxiety and stress, or maybe it's something that maybe you can explain, but we need to keep watching, and maybe we need another scan in 4 weeks or 2 weeks or whatever. And that stress and that anxiety that develops from not knowing, take away the joy from pregnancy and the enjoyment that God meant for you to have when you have a baby coming. And we're going to talk in a minute about the false positives to where these things that you might be worried about might not even be real. You know, you may go in just to get some pictures and just see your baby. Sounds really nice. It's very exciting. But what if you walk in just to get pictures and you walk out with information that you didn't want? Now what? What if you're seeing a typical practice in this country that doesn't have Christian underpinnings, and now, because of what you found out on this ultrasound that you really didn't want to know, they're pushing you to have an abortion? What about that? Now you're going home worried and thinking about things that you never would have even considered. You also, because of all this, might feel distance from your baby that's now being made to look or seem abnormal to you. There's a book called The Tentative Pregnancy by, I think, Barbara Kaufman. I need to link it below for you as well, that looked at this when amniocentesis came around. And it looked at the decreased bonding and the decreased joy that moms have now because they're more worried about making sure the baby's okay first before they actually enjoy the pregnancy or bond with the baby. And like I said, false positives can and do happen. So you might not be bonding with your baby, and you might not be joyful about your pregnancy, all based on something that's not even real. One UK study showed that 1 out of 200 babies who were aborted because of a diagnosis from ultrasound were found to have less serious abnormalities than the ultrasound showed. 1 out of 200. 2.4% who were not aborted, but they were diagnosed with something major, had conditions that were significantly over or underdiagnosed, meaning it wasn't what they thought it was. These findings can lead to multiple repeat scans as well, and some evidence shows that ultrasound has a cumulative effect, meaning the more scans you have, the more risk there is for the things to go wrong that we've talked about. Placenta previa, by the way, that I mentioned just a minute ago, the ultrasound might be good in finding. 19 out of 20 of those that in an early scan they find, 19 out of 20 are going to resolve because as the uterus moves, that placenta moves up with it. And so it's not even a big deal. I had that with my second baby where I went for my routine anatomy scan that I really didn't even want, but I got it. And I had a placenta previa at that point. I think it was marginal, meaning it wasn't even really touching the os of the cervix. It was just right next to it. And they recommended, the doctor that I worked for and the midwives that I worked with recommended that I get rescanned at 4 weeks and then just continue it to make sure that the placenta had moved. And I refused. I didn't get another one, I think, until 36 or 37 weeks. And the only reason I did that is because they wouldn't let me deliver in the birth center if I didn't. And if, of course, it had moved, because 19 out of 20 do. And so that was just something I had to worry about all through pregnancy that never ended up being an issue and wouldn't have ever even been known if we hadn't gone looking for it. When ultrasound is used for something called a nuchal translucency test, it can lead to amniocentesis being recommended or chronic villus sampling being recommended. And both of those are invasive tests that do have a risk of your baby dying from it. And yet, 19 out of 20 of those babies who are initially found to have that thicker nuchal fold, sorry, I stumbled over that, but the thicker nuchal fold, they will not have Downs, which is what they're looking for. Now, a lot of people are not getting that test done anymore because genetic testing will also look for Down syndrome, but some still do, and it's not without risks. And by the way, the genetic tests aren't perfect either. They also have false positives. Beyond that, you might be reassured that everything is fine when you get an ultrasound. Everything may look great. But diagnostic ultrasound only detects somewhere between 17 and 85% of babies with major abnormalities at birth. Think about that, 17 to 85, depending on what study you look at. That is a huge range, okay? And so you may walk out thinking, oh, everything's good, but it's not. But that false reassurance causes you to have false reassurance. I know that wasn't very clear, but it's just not always so easy to just look in there and just know everything, but you might think that it is. There's also a huge range of dose. And what I mean by that is how strong and how potent those waves are that are being sent into your belly to look at the baby. It's unregulated and there are no standards. And so you might get a low dose, you might get a high dose, and there's really not a whole lot of difference in the picture. So you don't really know what you're getting just by walking in and getting the ultrasound done. Now, some argue that you can't tie causation to ultrasounds. And to some degree, that might be true. But right here, I want to quote for you from this book, 50 Studies, that I talked about earlier. This is a quote from one of the studies that he talks about. And this is just something to consider. While direct ultrasound causation can be argued in isolation, there is the very real and practical concept of toxic synergy. It should be argued that diagnostic ultrasound initiates vulnerabilities to secondary stressors such as vaccines or other pharmaceuticals. This conforms with the views of some mothers who record every detail of their child's birth and development and see their children autistic at birth or triggered autistic by vaccines or other pharmaceuticals. This concept as a causation theory is supported by ultrasound synergy studies such as Kwan in 1996, and that is referenced in the back of this book. Think about that. Think about this concept of toxic synergy. Remember that the damage that may be caused by ultrasound is not necessarily something that's going to be glaringly obvious because it's on a cellular level or it's something underlying. And it doesn't happen instantly to where ultrasound happens and you automatically see the result, okay? And these things tend to be the ones that we call out of nowhere, or no idea how this happened, or they're unexplained. But think about how many things that babies struggle with, children struggle with, and even adults struggle with that are all unexplained, that we say we don't know where they came from, but they came from somewhere. All this stuff didn't just happen. We just haven't figured it out yet. And there's no way to know how things would have turned out if you hadn't done it. You can't do a control experiment on yourself where you know this outcome would be if we did nothing, this outcome is what we would get if we do the ultrasound. You don't ever really know. And toxic synergy is real, and that means that synergy means it kind of works together, it builds on itself. And so one thing can cause another thing to, just by both existing together. It's just that you can't prove it. Doesn't mean it's not there. Really, really, really recommend you get this book, by the way. It really connects some dots for you, even though it's dry and even though it's not written in a great way as far as like being entertaining. It's not an entertaining topic. But I think that you will learn a lot. It even talks about things like he mentioned autism. It talks about childhood cancers, chorioamnionitis, which is, you've heard chorio, it's the infection in your amniotic fluid during birth that they then give you antibiotics for, jaundice, all kinds of things: autism spectrum disease, ADHD, personality abnormalities, ophthalmological diseases, that means eye problems, various malformations, skin diseases. I mean, you name it, they talk about it here. You really need to get this book. Go look for the link in the description. All right, let's move on to ethical issues. Ultrasounds are now pushed on many women, and some practitioners will not even see a woman unless she has first had an ultrasound. But guess what? Ultrasounds are billable, and many offices now have ultrasound in-house, which leads to an extraordinary increase in revenue for the practice, because every ultrasound is a billable expense that insurance covers. And this leads to millions, if not billions, of healthcare dollars being spent on technology that is not proven safe or even beneficial in the long run. Think about that. Let's talk about some things that studies have found. These are some possible adverse effects on humans that are cited in the article by Dr. Sarah Buckley that I'll link in the show notes. All right. She references where these come from. You can get all of the links to all the studies in that article. Possible adverse effects: premature ovulation, preterm labor, or miscarriage. And I just want to say here, this one's a tough one. But I remember on several occasions when I was working in an obstetrician's office, having women come in bleeding, concerned about a miscarriage, and they do an ultrasound and there's no heartbeat. And they had been in the office a couple of weeks earlier and seen a healthy baby on ultrasound. And when they measure the baby after it has died, that baby stopped growing on the day of that ultrasound. Now, if you are a mom listening who has had this happen to you right now, I know that was probably a punch in the gut. And I'm sorry for that. But I don't want it to happen to you again. This is very real. Remember me saying how close that ultrasound transducer gets to that teeny tiny baby when you're in the first trimester? So you can't do a transabdominal ultrasound on a baby that's so small because the uterus is just not up high enough yet. It's still in the pelvis, and so the picture can't really pick it up because you got to go around bones to get there. So they go through the vagina and through the cervix, but that puts that wave right there next to it. And I can't even count how many moms I've had come in and the baby died that day or the next day. Maybe they got their first trimester dating ultrasound at 7 weeks, and they come back in at 10 or 11 weeks and they're bleeding and they think they're having a miscarriage. So, of course, they do another ultrasound. They go look and see there is no heartbeat, and the baby is still the same size as a 7-week baby. It's heartbreaking. And it's not something that most providers either can or will tell you, because we don't want to put guilt on you. We don't want you to feel like you did something wrong. And we also don't want you to blame us. And when I say us, I mean the medical system, because this is not how I practice. I know this was a hard point, but I need you to realize it so that you can protect yourself if this is a risk you're not willing to take. Next possible adverse effect is low birth weight, poorer condition at birth of the baby, perinatal death. Again, that's what I just mentioned with the miscarriage, only further along. Dyslexia, delayed speech development, less right-handedness. That's interesting. Something about the way your brain develops after having been exposed to ultrasound can cause you to become left-handed. Interesting. And then intrauterine fetal growth restriction after you've been exposed to 5 or more ultrasounds. That one had a little bit more detail to it, but intrauterine growth restriction means that the baby's just not growing as much as you would expect it to, and that had an increased incidence tied to people who had had 5 or more ultrasounds. According to the Chinese human studies in this book that I keep mentioning, there's lots and lots of results in this, but I wanted to just mention a few of them. Again, you really need to read this book. One is immune regulative systems become dysfunctional after they are irradiated with ultrasound. which could lead to you being vulnerable to subsequent stressors like vaccines or birthing drugs. And that's what I mentioned earlier. These are called toxic synergies. So just by having the ultrasound present or done on the person and exposed to the baby, it can cause other things to then have effects they wouldn't have otherwise had. They also found that ultrasound causes DNA fragmentation. DNA fragmentation is DNA damage. Think fragment, it's broken up. And DNA damage is believed to be a primary cause of cancer. And that can occur at less than 10 minutes of exposure to the ultrasound waves. Those are two really big ones. There's a lot more in this book. That's just two I picked. Okay, so this is a lot. It's heavy. It's a lot of information. Again, with those first two questions in mind, is this something that God even intends for us to do? You know, I remember I used to think before I had kids, you know everything before you have kids, right? I used to think if God wanted us to have ultrasounds, if He would wanted us to see into our babies before they're born, wouldn't He have put a zipper or something in there? Wouldn't He have like made some kind of way that you could look in and close it back up? It always bothered me. It never really sat right with me. And yet, for my babies, I had the one ultrasound at the anatomy scan. And honestly, I don't 100% say that it's always bad. And the reason is because if there is a situation where it's safer for you to be at a hospital, again, that's a good thing to know. But I will say that with the second pregnancy, that set me up for more ultrasounds because of the marginal previa. And I will say that when I went and got my scans, I was very, very specific that they needed to go fast. I didn't want all the details. I just wanted to know the very basic things I needed to know that it was okay to be at home. Go fast. I didn't want that transducer on me, but just a brief second, get what you want to look at, take it off while you're messing with the computer. I was very, very specific. And I would encourage you, if you decide to have an ultrasound done, be like that. Tell them to hurry it up. So what do you do though? Well, first you need to be very, very, very cautious about consenting to an ultrasound for all the reasons I listed. Be sure you've thought it through before you make the decision. Be sure you know what you're going to do with the information if you do get it. Be sure that you are mentally prepared. Don't let it steal your joy. Be ready to still enjoy it even if you don't get the best news. And then be ready to be a little bossy and tell them to hurry it up and get that thing off of you so that you get the absolute minimal amount of exposure possible. Do not go to the boutique scan places, okay? They're popping up everywhere because it's popular, okay? You can go in there and get these 4D pictures that are so very detailed, so real looking. But those are even less studied and less regulated than the regular ones, okay? Don't go to these places. They are unregulated and they mainly just exist to give you pictures and to give you warm and fuzzies. Then you're still going to have to get a diagnostic one because most places won't trust those. Okay. And for whatever whatever power you have, whatever control you have, which really is 100% because you can say no to anything, do not get first trimester ultrasounds. If you are going to a practice that will not see you unless you get an ultrasound at every visit, find a new practice. If you're going to a practice that doesn't trust your dating, doesn't trust the fact that you can know how to write down on a piece of paper or on a calendar or in your phone when your period started, if they don't think that that is reliable, find a new practice because that is reliable. And many studies have showed that that's just as reliable as ultrasound. Okay. And this is a brief little side note. Keep up with your periods, even if you don't think you're trying to get pregnant right now, so that you don't end up having to get a first trimester ultrasound because you have no idea what your dates are. All right. So some conclusions from the book. Ultrasound should really only be used for very specific medical indications, using the absolute smallest dose of ultrasound possible. Commercial or educational ultrasound should never be done, and ultrasound just to determine sex should never be done. Again, first trimester ultrasound should be completely avoided if at all possible. And if it's unavoidable, it should be severely limited and very, very fast. Same for second and third trimester. They should be avoided or limited to 3 to 5 minutes if deemed absolutely necessary, and just as quick as you can get them done with as little exposure as possible. And everyone participating in ultrasound, meaning the ultrasound techs, the physicians, all the people who are involved in this industry should be thoroughly trained in dose safety. And ultimately, nobody should be making the decision to get an ultrasound until they have had the chance to review all of the information like I have shared, information in books like this one, information in the articles that I've shared with you so far, and the articles on my website. Unless you have looked this stuff over and really thought about it and reviewed it, you should not be walking in to get your ultrasound without understanding it so you can make a truly informed choice. Now, it's hard to weed through all this. I go through this and a whole lot of other things in my course to help you have the information, because the information is hard to find. It's hard to know how to search for it. It's hard to interpret it. And so if you need help in your pregnancy trying to figure all this stuff out and how to decide and what to decide and all these different things, please go sign up for my course. You can find it at my website as well, go.yourbirthgodsway.com. We go through everything all the way from preconception all the way through postpartum and breastfeeding. And you've got a lot of decisions to make. You got a lot of, should I get this? Should I get that? Should I have this shot? Should I have that shot? Throughout your pregnancy, it's all treated as one big medical event instead of a natural event. I help you to weed through all those things, and I help you to stay low risk so that you can have the birth that you're dreaming of having. So
Real
if that
quick,
sounds good,
if today's
head down to the show
episode
notes for
blessed
that
you
as
in any
well.
way,
There's a link
would
there.
you head
or you can
over
just
to
go my
Apple
website
Podcasts
again,
and leave me a quick 5-star written review? It'll take you less than a minute, but it's the best thank you can give me. And it will help my show to reach more mamas just like you, so we can all find God's best for our families. I'll see you right back here in a few days.